Put this on. Okay, it's 11 o'clock, Monday, 30th of May, 2022. Very, very good morning to everybody. Welcome to our joint Dorset Public Health Board. My name is Councillor Mohan Iyengar of BCP Council. I'm Cabinet Member for a few things, but first and foremost for the remit for public health. A very, very warm welcome to councillors, officers, associations, members of the public who may be here, and those who are dialing in from further afield. Very good morning to you all. And in this particularly short and unusual and festive Jubilee week as well. We've got a large agenda to get through, so that's enough probably of the preamble from me. A very, very big pack has been put together. I'm grateful for officers and for others who've contributed towards the pack. There's lots of detail and there's lots of things to get through, so I'll try and make sure that we get through at a good clip. This has the makings of quite a long meeting, so what I'll do is we'll find, with your permission, a convenient spot, maybe after one of the items, to take a short break of maybe 5 or 10 minutes, so we can go and stretch our legs and then come back and resume. Okay, so let's get into that, if that's all right with everybody. First item on the agenda then is apologies. Do we have any apologies, please?
Yes, Chairman. Apologies from Councillor Karen Rampton, BCP. Okay,
that's noted. Thank you very much indeed. Item 2 then, the minutes of the meeting held on the 16th of February 20... Can we just discuss the governance of the chair? Okay, excuse me, we'll take it in that item then. Okay, just for clarity, what I'll do is I will be taking the chair for this meeting in agreement with my colleague, Councillor Peter Wharf. I think following this meeting, what we'll do is there will then be a review of what we will do with the chairing going forward, which is fine. And I just say that in the spirit of, beforehand, there has been the protocol of a rotating chair or an alternating chair from each meeting. And what we'll do is we'll see what's best and ensure what's most effective and flexible going forward. Okay? Yes, Councillor Wharf.
Right. Can I, for the purposes of governance, say I agree with what you've just said. We agreed, and this doesn't mean to say that this has to be for future meetings. You and I agreed over a year ago that alternating chairs, we didn't find that particularly helpful for continuity. We agreed that we would chair in a completely, as much as we can, non-political, non-local authority way. And we agreed that we would, in general, think about the chair transferring from one local authority to the other after a year. The reason we're not doing it after a year right now is that I have just got back from holiday about an hour ago, and you have prepared for this meeting, and you are an excellent chair, so you will carry on. And then, as you say, we'll review it at the next meeting. But for the purposes of the minutes, I want them to clearly say that this governance has been agreed by, you know, all parties who are responsible for it. Thank you, Chair.
First meeting we had of this new... Yes. Thank you. I would just confirm that at the first meeting we had of this new board, those arrangements were agreed for the 21-22 year, and that after that time a review of chairmanship would take place to ensure both DC and BCP had the opportunity to chair these meetings. Thank you.
Good, thank you for that. Thanks for the clarification then, Councillor Wharf and Mr Northover. Okay, so let's go then please to item 2, to the minutes of the meeting held on the 16th of February 2022. Again, in view of the long agenda we have for today, just by exception please, we won't go page by page. Are there any comments, challenges, observations please on those minutes? I was fine with them. I thought they're pretty accurate. Anybody at all? Okay. Thank you very much indeed, everyone. Okay, and what we can do the formality of signing off the minutes at the end of the meeting. Thank you very much. Item 3 then, declarations of public interest. Do we have any declarations from anyone? No, that's fine, thank you. No declarations of public interest. Item 4 then is the public participation. We have in our papers from pages 11 to 13 the outline of the protocol, the instructions, the guidance around any questions or comments from town or parish councils or from residents. I'm not aware that we have received any. Is that correct?
None received, Chairman.
None received. Okay. Thank you. We are flying through. I suspect the remaining items won't quite go as quickly as these first 4, but no questions. Thank you very much. As usual, of course, yes.
I don't wish to rain on your parade that early. We don't get public participation in this meeting as a rule. Can we have an action that we work with comms jointly to try and make the public more aware of the opportunities to come here? Because, you know, frankly, you do have, this is probably the only opportunity where you've got the Director of Public Health and the Cabinet members from both authorities. And, I'd like to think that that was you. So can we have some sort of action that says comms will work together to try and encourage greater public participation? And when I say greater, as there's been none as far as I'm aware, I think greater is anything greater than none. Thank you.
Councillor Wolf, yeah, I think, again, not for the first time, I think we had the same thing absolutely in mind. I was going to finish off by saying, typically, I think we don't get anything in this item, and it's a shame that we don't. And there's a parallel here with Police Crime Panel as well, where, in fact, we do need to find a way of encouraging something in this area. Thank you. Good. Yeah.
Okay, can you hear me now? Just a sort of slight amendment to that last action. I'd be very glad to work with Lucy Mears to perhaps set up in advance some of the content of the meeting. If we could trail that perhaps through the social media channels, that might be helpful. And I was just going to ask both Cabinet members whether they'd also consider using their own channels to publicise items of interest that might be coming to the board. So just to generate a little bit of interest in advance, because that's how we get public representation, isn't it?
Thank you, Mr. Crowe. See, Councillor Wolf is agreeing. I absolutely agree as well, through both routes as well, through your own good comms office and through ourselves, through our own comms auspices in our respective councils. We'll do that as well. So I think there's an action on 3 of us, on Sam's team, on Councillor Wolf, on myself as well, please. Thank you. Good. Item 5 then, please, the forward plan. I think we've got a very complete forward plan, but let me not prejudge the discussion we're going to have. I think, is it Sam, you're going to take us through the forward plan, are you? This is pages 15 to 18 for everybody in the pack. Thank you.
Thanks very much, Chair. So I've only got a couple of comments to make because, as we've noted previously, the forward plan tends to fall into a regular pattern of monitoring reports. As we've discussed in the informal Joint Public Health Board, we want to get into more of a rhythm where we're starting to present some of the scoping and the developments for decision to the Joint Public Health Board. So the first recommendation I had on the Joint Public Health Board forward plan is to note that we're going to be discussing the business plan later on in the meeting, and one of those recommendations is then to work from Appendix 2, which presents the work programmes that have been prioritised for the next year, and that will be used to populate the forward plan in more detail going forwards. And then the second issue I was just going to raise with the board today was that I believe we've got the next meeting in July, which is only 6 weeks away. And then we don't have anything until November. So it's whether we could perhaps look at the timing of those meetings, because it feels as if July might be a little bit too early, but November is too late. So if the board agrees today, I'm happy to work with Democratic Services to look at an appropriate schedule.
This item has come up now because I was looking at the dates for the future meetings. They don't look, first of all, evenly spaced, although that's probably not the most important consideration, but it looked like we were going for a long period without meeting at all, which didn't feel right. So are you okay then? Well, let's take this at the end of the meeting after we've discussed the items and feel what's best. Thank you. So was there anything else on the forward plan then, Mr. Crowe?
No, thank you, Chair.
Okay, so can I just open the discussion to anybody who wants make any observations? The item here is just to consider the forward plan, and mindful that we'll be probably coming back to it in the business plan conversation later. But is there anything anybody wants to say at this point? Councillor Wharf.
Can I just check with the Director of Public Health, because we're talking informally of holding some sessions to review the structure in terms of reference of the Health and Wellbeing Board. Is it relevant to discuss those in this particular forum? Thank you.
Thanks very much, Councillor Wharf. I think it's a really good point, and as the integrated care system develops, it would be helpful to keep members of the Joint Public Health Board updated. So, as you're aware, we're thinking about a development session to look at the future of both Health and Wellbeing Boards. And of course, there is an overlap between some of the issues that the Health and Wellbeing Board consider and the public health issues considered by the Joint Public Health Board. So I would hope that later on in the summer, we could update the Joint Public Health Board with those developments.
And in fact, if I may, I take that a little bit further with what's emerging in the integrated care system, with there may be a more remote link to the integrated care board, and then the upcoming partnership later on in the year, but something that looks ahead and anticipates where they're going as well is probably what we need to do. Anything else at all on this forward plan? Anybody? Okay. I think we've probably not done it justice with the conversation right now, but I actually do welcome that this has been put together, and I think this is the fullest expression of it that I've seen. Let's come back to it later then. Thank you very much. Okay. So the item was just to consider it, which I think we have done, and we'll come back to that. So let's go to then, please, item 6, which is the Director's update on public health activities, of which I think it's just a verbal update. We don't have a report for this item.
Thank you, Chair. I've actually got a short presentation, so I'll just take the members through that now. I'm just going to present through Teams, so hopefully it should come up on the main screen. If you bear with me a second. It says only meeting organisers and presenters can share, so I don't know if I'm able to be given access, Elaine. Thanks very much. Okay, hopefully everyone can see that now. And that's okay to move forward. Right, so just a director's update from me looking back over the period from when we last had a board meeting in February. I think my overall summary is that the 3 themes that have been dominating our business as a public health team have been recognising that the health protection system is changing as we move to a living with COVID-19 strategy and working through the implications of that for the public health team. Rachel Partridge is going to present separately on the agenda today, following on from COVID, which should be a really helpful summary and overview of where we got to at the end of COVID. But it's likely that we'll also want to bring back further information to the Joint Public Health Board as the team are involved in undertaking a piece of sector-led improvement about the new health protection system. So that's quite a live piece of work at the moment, and we'll continue to keep the board updated. I think the second strand has certainly been dominating my work programme over the past 3 months, which is supporting the local system to be ready for the integrated care system. I've been doing a lot of work to support not only the Shadow Integrated Care Board, supporting the recruitment of new executive posts for the Integrated Care Board, but I've also agreed to lead the development of the first integrated care strategy, and the engagement and development work for that is taking up a significant amount of time. But I think it's a really important role, and I think the fact that Public Health have been asked to lead it is a really positive sign for the new system. And the Chair will be aware, as will Councillor Wharf, we've also been having discussions with both councils about making sure that we're developing that equal partnership and coming forward with some really strong areas of collaboration where we feel that councils and the NHS working together can make a real difference to outcomes and for our residents. The third item there just relates to a programme that I've been leading for the past 2 or 3 years, which is this population health management programme for the integrated care system. I'm likely to hand that over to the new Chief Medical Officer when the Chief Medical Officer is formally in post, when the integrated care system starts on the 1st of July. But just to note that we were successful in securing recurrent funding for the team that carries out that work. So these are people who are essentially employed by Dorset CCG, soon to be our Dorset. NHS Dorset is the legal name of the new Integrated Care Board. But I think it's really healthy that the system has recognised the importance of that team and that they've managed to find the funding to secure those posts. Then the third item, we've got an extensive agenda item on today, which is the development of the Public Health Business Plan. We've been working with the team to identify priorities, and we'll talk in a bit more detail about how we're scoping those programmes and supporting the recovery of the team and continuing to work on our resilience, because I think, if I was being honest, the last 2 years have seen us taken well away from our business as usual work. So it's important that we spend some time as a team re-engaging and thinking particularly what is most important to deliver over the next period. And then just some notes under our main domains. Just some notes from me about health protection, even though Rachel's going to fill in with a bit more detail. We closed down the Health Protection Board. This is the COVID-19 Health Protection Board, which have been meeting every 2 weeks, following the move to the Living with COVID-19 strategy. There's no longer a requirement to keep the local outbreak management plans updated, so we also stood down the local outbreak engagement boards. We've supported both councils with limited continued access to lateral flow testing, just for a limited time, as the end of access to public testing was stopped at the end of April. This is really to cover people working under councils who may not be able to access testing via the existing channels. So a number of roles that are working in community settings where they're working with vulnerable people. In the background, we're starting to think about preparing for the National Public Inquiry into COVID-19. So I'm doing a piece of work with Dorset Local Resilience Forum to make sure that our information is secure. We're archiving the records of our decisions and that we've got an appropriate process in place to make sure that we can respond to the inquiry. Rachel will talk about restarting the health protection network. This will be responsible for ensuring that we've got the local response to health protection issues right for our system, working closely with UK Health Security Agency and their local leads, their locality leads for our system, but also for the new integrated care system. So if you think back to COVID, the importance of things like infection prevention and control, the support that we offer to some of our high-risk settings, the idea behind the network is that we continue to bring those professionals together routinely to look at some of the surveillance, and that we're also in a position to respond to any actions that we need to take locally in response to threats to health. So I've talked about the sector-led improvement piece of work in readiness for the new network. As soon as that's been completed, we'll share that with the board. And I guess my final point is just to recognise that the UK Health Security Agency is very much in transition. It's swelled to cope with COVID, but many of those fixed-term posts are now coming to an end. But actually in the southwest, the baseline number of people working for UK Health Security Agency has slightly increased from before the pandemic. Quite difficult to see, because if you remember, Public Health England was broken up, and Public Health England didn't just work on health protection, it also worked on health improvement. So a number of those roles have also transferred to the Office for Health Improvement and Disparities. But we're now working on a regular basis through the South West Partnership Board, which is the meeting where directors of public health meet with UK Health Security Agency, representatives from OHID and the Department of Health and Social Care to make sure that there aren't any issues falling through the gaps as the public health system changes. So just a couple of notes on things that I've been doing around the health improvement agenda. I think the most important is working with the Police and Crime Commissioner, Chief Constable and both councils in the background on the setup of the first of this new drug partnership boards. So this is a national requirement by the new strategy that was published in December 2021. There'll be a Pan-Dorset board. We're going for the first formal meeting around about September this year. So a bit of work going on in the background to look at terms of reference and membership and to develop an agenda and a forward plan. We're continuing to scope the options for the delivery of the new health checks programme. They'll be coming to the informal Joint Public Health Board on the 30th of June for fuller discussion with members. And then I was just going to flag today that in the background, there's been really good progress actually made by our NHS colleagues on establishing a proper tobacco control programme in both local hospitals. So we work with a woman called Heidi Croucher, who's been seconded to Public Health Dorset. But Heidi leads on developing that programme across both hospitals, Dorset County Hospital and University Hospitals Dorset. She's done a fantastic piece of work actually to make sure that the teams are in place, and screening is now regularly taking place on all inpatient wards. And we've received funding as a system of almost £400,000 for this work continuing in 22-23, and we'll start to share with the board the results of that programme as people are screened, identified as wanting support for smoking cessation, and we'll be able to provide further detail about the outcomes as the year progresses. But it's a really good piece of system work, and I'd just sort of like the board to recognise all of the work that Heidi's put into that, because she's done a fantastic job. And then under our healthcare public health work, probably the main focus in the past 2 or 3 months has been making sure that the Joint Strategic Needs Assessment is ready. So we've been doing a lot of engagement work as a team with organisations across the local system. And the point of this is that we can then come under each Health and Wellbeing Board in the summer and get that signed off after a healthy debate, and then feed the priorities through into the integrated care strategy. We've been doing a piece of work with Dorset Police to look at sort of reviving the real-time surveillance system. So this is a really important piece of data where we work with Dorset Police to understand not only who has attempted suicide, but also to gather more data from all of the organisations that feed through following the coroner's inquests to understand the pattern of completed suicides in Dorset. The group that we're interested in is actually a group that regularly attempt suicide, who are very different to people who often take their lives through suicide. And it's this group that we're hoping that we'll be able to start to develop an idea of personal care plans, which would help the emergency responders out of hours to understand how best to support people often found in crisis, out of hours, and sometimes taken to inappropriate places. So that's basically hosting an analyst with Dorset Police to look at how we overcome the blocks, make sure that we've got appropriate information governance and assurance processes in place, but then to get the data flowing again. And we were in a very good position before COVID, having set up this system, regularly getting a good view of the data feeding into both suicide prevention plans. But since COVID, we've had problems accessing that data, so this is a piece of work to look to unblock that. The team have also been supporting an autism needs assessment, working with our Dorset, just to support looking at reviving the way that we do assessments for that service and to look at options for a new pathway. And as I mentioned in the first bullet point, we've also been busy developing insights to support the integrated care partnership strategy. This has been a series of engagement meetings, including understanding the impact of long-term conditions in our population, some of the most important gaps due to inequalities, and also working with both children's directorates of both councils and Dorset CCG to understand what we should be saying about children's health and well-being in the strategy, and also mental health organisations. They're likely to all feature as key priorities going forwards. And I think this is one of my last slides. It's just a bit of influencing work that I've been doing as Director of Public Health across the system and region. I've been involved with a collaborative piece of work at South West Region to help establish an assurance framework for public health involvement in integrated care systems. That's been signed off by NHS England. That was work with the Regional Director of Public Health and the Office for Health Improvement and Disparities. And it's basically just saying that the assurance process will look at key lines of inquiry when integrated care systems are established, just to make sure that directors of public health are fully involved so that they can carry out their statutory population health duties, that systems have a plan in place for tackling inequalities, and that they're also clear about developing an outcomes framework agreed by all partners by April 23. So that follows the integrated care strategy publication. We've been doing some work, or colleagues in the public health team have been doing some work in support of the development of the NHS Green Plan. We received a little bit of funding to support that work. I think the point here is making sure that both councils are linked into the work and cited on it, and that we're not duplicating or being inefficient, and that the NHS isn't missing opportunities to think more broadly about the move to net zero by working more closely with both councils. And then finally, I'll just mention here the work that we've been doing with both councils to clarify our asks and offers of the integrated care system, developing proposals about how we build a strong partnership approach going forwards. We start to identify the most important outcomes, local priorities, and ways that we can work together to improve health and wellbeing, taking advantage of our natural assets. And I think that's it from my update. So hope you found that helpful, and I'm happy to take any questions.
Thank you, Sam. Very helpful, as always. I've got a few comments, but I'll hold back for the minute. Are there any comments, questions from anyone at all? Start with Councillor Wharf.
I'll probably steal your thunder again by saying thank you to Sam Crowe, the Director of Public Health, for an extremely comprehensive review of the activities of the area of public health. Can we make sure that copies of those slides are distributed to everybody? Because unless you have an issue, I'd like to distribute them to a variety of officers and members within Dorset Council, because I think they're very informative, and I think that will help communicate what we're doing. Point one. Point two, I think there's a lot of really good work, so I assume Public Health will again work with their own comms department to make sure that there are useful messages going out, and work with our comms department to make sure that there's a degree of coordination. And point three is a quite separate point, and I'll try and say this as carefully as I can, because it's detailed, but I think it's quite important. The Pan-Dorset Joint Drug Committee, I'm not quite sure of its name. I was having a session with David Sidwick, the Police and Crime Commissioner, and I was talking to a variety of people across the piece to do with this, including my officers. And my reason for raising this is what I don't want to get to our inaugural meeting and end up being sidetracked by having a discussion on philosophy rather than on how we're going to address the issues. And the reason I say this was I was somewhat surprised by the diametrically opposed views of a number of people within this arena. So some people have a completely strong view, and I'm not saying whether this is right or wrong, that gateway drugs, there should be huge effort put into stopping gateway drugs because they lead to stronger drugs. It's a perfectly respectable viewpoint. And there are other people who do not have that view and think blocking and putting all the effort into stopping gateway drugs is actually not a good use of time, when actually the stronger class A drugs are the ones that we should focus our efforts on identifying the sources of supply and of use and of assistance in those people who are abusing them. Now, my point in raising this, and this may not be right, and I'd seek some advice from you, Sam, as the Director of Public Health, I am concerned that we'll get to that meeting and we'll end up with an argument about some basic philosophical disagreements rather than what it is we're doing to assist people. Is there something we can do in the meantime to try and resolve that? Or is my concern about this massive, what I view as a massive fundamental disagreement on the issue, am I worrying far too much? Thank you.
That's a really, really good challenge and a really good question. I'll try to break it down as best I can. I would hope that the board would be focusing its work right from the first meeting. So that's the point of the pre-meets, is to make sure that we've got a forward plan. The board's purpose is really to provide assurance on delivery of the national strategy. So there will be very, very clear delivery plans in each of the council footprints for understanding the treatment response, but also the enforcement response and the links out to criminal justice. I think the point you raise about the differing philosophy is important. What I would say from an evidence-based perspective is that the evidence for reducing demand is not strong. And that's the bit that I've been talking to the Police and Crime Commissioner about, because the national strategy makes some very, very strong statements about reducing demand. And yet the most evidence-based intervention we have is making sure we've got enough funded treatment places. So I think it will be an evolving discussion, and I guess it's very helpful actually that you've raised it, because what I need to think about is where we have these discussions in advance of the set piece in September, and make sure that we're clear about what we're doing as a board. I don't think it makes much sense to debate these, but my role as the Director of Public Health is to clarify and point out where the evidence is strongest, and I'll continue to do that through the board.
If I could just carry on with something on that. Thank you, Councillor Wolf. Your question was particular to sort of the drugs area. I was actually going to ask the same thing more generally, because two things are going through my mind from the presentation. Sorry, I seem to have jumped in, but I will give people plenty of time. Is that two things on there. One is to do with the content, literally, what are the priorities, what is the work, what is it we're going to address? And the second thing is the structure around all of it, which is how do we organise ourselves for which discussion in which place, and particularly for decision making, which is relevant to what's just been said. Just on the structure point, it may be unfair to ask now, Sam, for instance, is it clear where such an issue such as Councillor Wolf has raised, is it clear where that would be finally decided as to what will be Dorset's policy on this going forward, if policy is the right word? Or do you think, I'm sorry to put you on the spot at this moment, or do you think it's not clear and we actually have to work that out, and pretty quickly, I'd imagine, and for that and a similar number of instances, we've got to be clear where the decision is being taken, so we don't go forward for the next 2 years still debating these things. We actually decide it and move forward.
Yeah, thank you. So I think there are some things that the strategy is very, very clear on, and one of them is the funding coming into the system is very clearly targeted at additional drug treatment places. So on the drug treatment side, there's no scope for flexibility. That money is deliberately to expand access to the current treatment system. I think the bit where we need to work through as a board is understanding where we do have some flexibility around some of the current interventions that are carried out in schools, for example. So some schools have a focus on trying to increase awareness of the harms from gateway drugs and a whole load of other substances. I know Dorset Police have been interested in this area for a long time. They've been reviewing their offer. I think the discussions that we need to have as a board during the setup process need to be clear about where those discussions take place, because it might be that it's not appropriate to have them at Pan-Dorset board level. It might be that they are better tied to delivery plans. So this is something that I'll take away from the board today. I'm happy to have a conversation with the PCC as we start to develop the terms of reference and we start to think about the forward plan. I'm hoping that some of that will come out in further discussions. Is that okay?
Yeah. I think just on a fine point, I think you mentioned a sort of the local authority level delivery plans, if I heard you right. I think some of this actually still goes up to the Pan-Dorset, if policy is the right word, or literally what outcomes, broad outcomes do we want, particularly thinking of the drug side of things. But I'm happy that we take this forward. It wasn't to sort of immerse us in this debate now, but I think there's some urgency around this, for this and some of the highlights in that report. And as we go forward with the strategic needs assessment as well, I'm back to a content item here, which is for each of those, there'll be implicitly a policy for which it needs to be probably crystal clear. And my point here is not so much about what what is that policy? What is the content of it? It's about which group of people are getting together to nail it, frankly. And after that, there shouldn't be too much dissension. This is the way we're going forward with this. So I think we're probably building up to actually when the next meeting's going to be, both the informal one and the next formal one, to actually be ready in time for when the ICB starts and also when the partnership comes behind it. Okay. Thank you. I had some other points, but I'm sorry, I seem to have just jumped in and crowded people out. Was there anything else? Yes, please. Can you give your name, please, and then, yeah.
Hi, yeah, it's Vanessa Reid. I'm the Director of Nursing at NHS Dorset CCG. Thank you. Sam, it's a quite straightforward question about the drug board. I know you said you're developing the terms of reference, but do you have an idea of where it will sit in an overall structure? So where would that board report into? I don't know if you might not have had where will that sort of oversight reporting and assurance go from that board? Because when you work in that sort of multi-agency way, sometimes it's quite difficult and you end up going in disparate directions with sort of accountability. So it was just a question about that, accepting you might not have got that far yet, Sam.
Thanks, Vanessa. I don't think we've got that far yet. I'd have to check this out, but my understanding is they are going to be independent boards. That it's more about the structure of delivery below them. So the Home Office will be expecting to receive assurance that the strategy is being delivered. That's the purpose of the board. I think having looked at the initial guidance, one of the things we need to guide against is having a board that's too unwieldy, because obviously there's a huge list of people, representative statutory bodies that are going to be potentially on the board. Personally, I think that's a bit unwieldy. So what we're trying to do is to sort of right-size it. But we do need to get the representation right so that we can at least look at the assurance at system level. And part of that will be a conversation with the integrated care system to identify the most appropriate representative.
Yeah, Councillor Wolfe.
Sorry, and thank you for the question. Very interesting. A lot of what I said earlier led from a lunch I had with the PCC related to something completely different. My understanding is that this drug board will be chaired by the PCC, and my concern, which is why I think we need to, and I think this is a really helpful conversation, and yours is absolutely right. My concern, as I said to the PCC, is that this will be seen to be a police-led initiative rather than a community-led initiative or a clinical-led. I'm not even sure what it should be, other than I'm pretty certain I don't think it should be a police-led initiative on its own, because I think there would be my earlier conversation related to that particular point. So I think we need to, you know, the chair, without being rude, needs to be reminded of their responsibility to be a chair and to be all-encompassing rather than representing the views of the organisation that they lead, as per our conversation earlier, Mo. And we need to actually think about where that committee sits and what it's doing, because if it's independent, I don't mind that, but there has to be some relationship elsewhere, and I don't see it. Thank you, Chair.
For the record, absolutely agree, Councillor Wolfe, with that. We've talked before on this, and I think there's something around, you know, let me try and put the comment fairly from my perspective. It's, you know, for the whole onus to be on the police is wrong, but equally for the direction and the priorities to be set by the police, I think is also not quite what we want. It's a broader thing, which of course makes it in a sense more difficult with more people to involve, but that seems to be the right way to go forward with this, and we've got to start as we mean to go on with this. Thank you. Any other questions or comments, please, on this item on Sam's presentation?
I'm concerned that we do have an action, because we've all agreed, but there's a danger that we'll be in violent agreement and then we'll turn up to the meeting and we'll have got nowhere. Can we have an agreement that if nothing else, there is a pre-meet between the two of us and the Director of Public Health to try and tease out some of these issues? I mean, maybe there should be some other people there, but what I don't think should happen is we wait until we get to the first meeting of the drug committee and, you know, we just end up with an argument. So can we have an action that says we're going to have a pre-meet, we're not quite sure when, we're not quite sure who, but what we are sure is we're trying to tease out some of the issues prior to the meeting?
I can agree with that, Councillor Wolf. Was your request directly about the drugs, or was it a more general point? No, absolutely agreed. No, I think actually more vigilance, I think, will serve as well on this one. Can I just make a few points myself on this, and I'll try not to repeat what's been already said. Just first thing, absolutely for the record, I'm not sure if we did it in February's meeting, but just to record our thanks to the Health Protection Board, Sam mentioned, and I was part of it as well, for the work that they've done over particularly the worst of the COVID-19 period, and also thanks to the COVID outbreak management boards that ran as well. And a lot of people came in, a lot of them unnamed, thanklessly, etc., came in and did their bit, to say the least, over that period. So our thanks to them. The health check, the options going forward, I know this is a specific. Sam, could you just say a little bit more about where we are with that? Because we know the story, I hope members are familiar with the story that Sam's briefed us on in the past. Could you just say a little bit more that was on the slide about where that is, please?
Yeah, I wasn't intending to say too much today because on the 30th of June, we'll have a full briefing in the informal Joint Public Health Board. But members will remember probably the biggest area of development is making sure that we are able to invite people, if possible, from the Integrated Care System's digital platform, so the Population Health Management System. And currently, we have about 28 providers of 103 that are delivering the programmes. They have restarted, but with only about a quarter of the providers in the market. What we're really looking to do is to relaunch properly in the spring and particularly target those areas where we know that cardiovascular disease is more of an issue, but we've always struggled to get providers into the market. So that'll be the focus for the discussion on the 30th of June, because the team have been doing quite a lot of thinking about that.
Thank you, Sam. And just the final bit was, in fact, just to broadening the point that Councillor Wolf was making, please. So I'm very happy that we have our next meeting in the calendar to talk about, for instance, what should be the drugs policy, but I think we were talking more broadly than that. I've got a general, still ongoing sort of, wonderment, I'd say it's almost disquiet about how we are. I think a lot of good work has been done, but now with the imminent setting up of the board in July, the Integrated Care Board, and then the partnership, for which I think it's still undated, but it's something in the autumn. I think the partnership board will come into being. I don't think we have yet, unless I'm mistaken, we know who exactly is on that board, both in terms of names and in terms of actually the bodies which will be on it. And much of that maybe we can only control from a distance, or we can only influence from a distance. But I think what we can do and try and get our arms around soon is literally how we organise ourselves, which is this board, the Health and Wellbeing Board, and our link to the community safety partnerships, for instance. And they're just three big ones in the frame. We could also mention Police Crime Panel if we wanted. And since we've made mention of the Police Crime Commissioner, I do have this maybe at times naive feeling that Dorset should be a compact county with now only 2 local authorities, not 9 that we had before. 1 CCG, whereas elsewhere in the countries it's rather more mottled with many authorities and at least 2 or 3 new integrated care partnerships in the mix. Well, we've just got 2 of them, 1 commissioner, and 1 of the other things as well. We must be able to get this together and say we've got a unity around the joint strategic needs assessment, and we've got not a unity over the governance, but more of a unity that we have now around where the key decisions are being taken about the priorities that you were putting up there, Sam, which I totally agree with, but literally what's stopping us moving forward with those with momentum, with pace, and with at least a certain amount of agreement among people. We know that Dorset is probably just, not quite at the forerunners of setting up ICB, ICP, which is okay in itself. I think we do have the potential now to accelerate on a national scale faster than some of the others. And this is not a race, it's all about literally what's best for people, for their broader health and well-being, absolutely. Just on the other hand, there's no reason to sort of stand still. I'm not saying people are. There's no reason for us to sort of continue with arrangements that we may find still dissatisfactory. Let's move ahead and fix them. Okay, is my plea from this. Okay. Any other comments at all from anyone? Okay. All right, thank you very much. Let's move on, but thank you, Sam, for your presentation. There's a lot of very, very, very big, very important stuff in there. Okay, so talked about forward plan, 6 was the director's update. So item 7, please, is the finance report. And in our papers, 19 to 27 is the main report, and then we've got the internal audit report, pages 29 to 34. Is this you again, Sam? Is it? Sorry, excuse me, yes. Remind us of your name for the recording, and welcome.
Thank you. My name is Sian White, Service Manager supporting public health within Dorset Council. Just going to give a quick overview of the finance report. So in 21-22, the shared service budget was £25,360,000. The final outturn was £706,000 underspent, and this was increased from the underspend reported at the last board. The underspend has been added to the ring-fenced public health reserve, and as at the 31st of March, there was a total of £2,647,000 within that reserve. The previous agreements through the board mean that a proportion of the reserves are fully committed against prevention at scale projects, kickstart community health improvement services, additional safeguarding capacity, and place-based work. After the committed reserves have been accounted for, there are £1,158,000 worth of uncommitted reserves still in place. At the last board meeting, the contributions for 2022-23 from each authority were agreed, giving a total opening budget for 22-23 of £25,615,000. This is based on a shared service receiving 60% of the uplift to the grant and 40% remaining with each council. The uplift within the shared service has been applied to early intervention, an increase in health improvement and consolidate and expand the Live Well Dorset offer, health protection, commissioning of an oral health survey, and additional general operating costs. The initial forecast for the year suggests that an underspending year will be mainly due to the reduced levels of activity within the health checks. There are other external factors that could create financial risk and volatility, which are outlined in the report. Alongside the shared service budget, each council provides a range of services with public health impact and retains a proportion of the grant to support these in different ways. BCP retained £8,112,000 in 2021-22, and there was an underspend on the drugs and alcohol, which has been used to cover additional costs within the early help children's area. In 22-23, BCP will retain £8,338,000, which will be used to support the drugs and alcohol services for children's and adults, children's centres and early help, as well as overheads. Dorset Council retained £1,117,000 in 21-22, which was fully spent, and in 22-23, Dorset Council will retain £1,277,000, which will be spent against community safety, community development work, children's early intervention, and prevention and support for adults with complex needs, as well as overheads. So the recommendations for the report is to note the 21-22 outturn, approve the 22-23 opening budget, and to note the 22-23 plans for the retained elements within each council. Thank you, Chair.
Thank you very much indeed. Okay, and thank you for a very comprehensive report, as well as enclosing the internal audit report as well. Any questions, any comments at all, please, on the finance? Is that Councillor Carl Jones? Yes, thank you.
Thanks, Mohan. I think I probably flagged this up last time. we met, but it does always worry me when I see an underspend, because I think, are we not delivering the services that we need to for our residents? Therefore, I'm just going to seek again from Sam that reassurance that the numbers are right and that no one's been disenfranchised because of that underspend. Thank you, Chair.
Thank you. If I could respond. Thank you for the challenge, Councillor Carr-Jones. I think it's a good one. As the paper notes, a lot of our underspend has been building up because of our inability to provide face-to-face services like health checks, particularly during 21-22. But obviously the board will note that we're still not able to deliver up to the full value of that programme in 22-23. So we are building up a reserve. What I wanted to flag with the board today is that the £1.5 million that is uncommitted, I'm quite comfortable that we start a discussion about how that should best be used to support either additional programmes or support to both councils within the grant criteria to be able to use the money effectively. We don't want to sit on uncommitted reserve. So I'd hope that that would be perhaps a discussion at the informal board, and then we'll take that through both Section 151 officers to make sure that there's a plan for use of the money. That seems appropriate. I think the other point I wanted to make, which might have been buried in Appendix 4, is we're committed in this paper to sharing or giving greater visibility to some of the additional income that the shared service is receiving. Now, not to make this sound like an excuse, but it makes our financial planning quite difficult when we're getting lots and lots of non-recurrent money in from different sources, short timescales. In some instances, government have committed to providing us with 3-year grants, which they then stopped after a year. So what we've tried to do in Appendix 4 is to set some of that additional money out much more clearly so you can see what's running through the shared service. But I agree with the premise behind the question, which is we shouldn't be sitting on uncommitted reserve, and if we can find an effective way of using that money, then we'll do so. I'd just like to flag, I think there's a real opportunity through the 2 new place-based partnerships, which will be part of the integrated care system going forwards, to have some public health funding to enable those partnerships to start to think through what more could be done closer to communities to pick up on some particular public health priorities that the partnership's interested in. That would be one recommendation that we would make as a public health team for looking to use some of that funding, but I look forward to discussions through the Joint Public Health Board. And Chair, if it's helpful, I was just going to explain Appendix 4 very briefly. So,
that's right. Can I just come back on Councillor Carr-Jones' point, and in agreement with it, it's just a general point I'm making, which is, one, yes, absolutely, the councillor mentioned it at last meeting, I agree with it. Just underspends in general, we're absolutely open to this challenge, quite reasonably from people. Oh, well, are we delivering the most? And, you know, sort of the sign of the times, are we delivering the most that we can? The difficulties, the constraints are absolutely understood, Sam, but the challenge is a good one. And equally, the equal and opposite challenge is therefore, if we have taken that money in a sense from taxpayers and we're not delivering service, we ought to be in a sense giving it back to them as well, which is slightly not quite as reasonable, but I think is has got some validity as well. And we hear that with the CT in general, the council tax in general.
Thank you. Thanks for that, Sam, and I appreciate that. What the question I guess would like to pose then is that if there were something around the health and well-being of some, let's say, some of our homeless cohorts, would it be unreasonable to think that maybe we could bid into you for some of that funding to help them?
no, I don't think it's unreasonable. All I would say is that we would hope that there'd be a sort of helpful set of criteria to judge. So if there are other things on the list as well, we'd work through that in a proper way. And I think the paper also highlights that we've actually provided funding under Dorset Council to enable some of that work to continue. So I think we should have a healthy debate about it. But yeah, I'm not opposed to the money being used under each council as long as it's within the public health grant criteria.
I think with that, what I'd add is I actually like the principle of that and so on and the dynamism of it. I think just the risk of offending some people in my own council, if there's a parallel with the SIL arrangement, sometimes the administration of that is anything but dynamic. But I think as long as it can sort of meet the goal in a nice, flexible and dynamic way, that would be a good thing. It does. Councillor Carl Jones, what I think, just if I could actually generalise that, what was going through my mind is if this style from the government of you sort of bidding for pots of money and giving pots of money in a way that's kind of what's a reasonable word, is sometimes, you know, unexpected, in both a disappointment and a pleasant surprise kind of way, and then also it's time boxed, or sometimes they're finite, which is they're not in the base budget and therefore they're for only things that can be temporary. I suppose the best we can do is just have a ready-to-go list of areas where they can go, where we are not committing to people, to residents for the longer term about it, sadly, but literally where we've got initiatives where, yes, literally, if we can get some money, we do this, we do this. That's probably the best we can do. You may say, Sam, we've already got such a list, but if we don't, that'd be a good thing to have. Okay. Anything else at all on this item? At all, was there anything? I just had a couple more bits myself. We are just being asked to do three things, as the finance officer has said. Just note the 700k underspend, duly noted. Note the plans for the fiscal year that we're in for 22-23, but importantly approve for the current year the opening budget for the shared service, if I'm right. That's the just north of £25 million figure. Okay. So we'll vote on the approval of the opening budget. So all those in favour of the opening budget? And think of the... sorry? Okay, that's unanimous, I'm told by the officer. So that's carried then. I didn't realise there were so few of us voting, but thank you. Okay. We'll close that item then. Thank you very much indeed. Right, let's go on to our next item. Okay, so item 8 then, Health Improvement Services Performance Monitoring, report from the Director in our papers, pages 35 to 63. Okay, so I'm back to you, Sam, and I guess one or two others will come in. Thanks.
Thank you very much, Chair. So I was just actually going to note Jane Horn's apologies, and also we've got a number of consultants who would normally be with us, but as it's half term, I'm going to do my best to represent this paper as best I can. I just want to talk you through a couple of key points. It's quite a long paper. Starting, I guess, in order with the health improvement and the behaviour change service known as Live Well Dorset. It's really pleasing to see an almost normal return to activity. Activity this year is up 43% compared with the main year of the pandemic, but it's still not at activity levels before COVID-19. So still a little bit of way to go to get activity back into the service. I think it's really pleasing that they are still seeing proportionately more people from the most deprived areas, which is exactly in line with their service objectives. That's the way that we set the service up, and we try to incentivise them as much as possible to work in those areas. Weight management and smoking cessation remain the most engaged with pathways, so no change there. I wanted to draw the board's attention to paragraphs 10.6 and 10.7, where one of the key recommendations in this paper is to seek the board's agreement to start scoping future options for the service. I'm hoping that both portfolio holders have had the chance to see the Live Well Dorset service in action at the outpatient assessment centres. So that's the Beals, or the former Beals site in the Dolphin Centre, and at Southwarks House in Dorchester. Can I just check, Chair, have you been on that visit?
Unfortunately, the visit, they had to cancel it because of some hiccup. They were very kind about it, but it had to be postponed last minute.
I have been to the Southwarks House. I was blown away with the professionalism and with the organisation Forgive me, I recommend you strongly go so that we can jointly talk from a position of strength, and it was excellent. Thank you.
Thanks very much. I'll make sure that we try to get another visit in train. The point is, I think recognising where the integrated care system is heading, that was a very, very good pilot for starting to put behaviour change services as close to some of those big health and care pathways as possible. So we've recognised within our business plan the need to do some work scoping options for the future delivery of that service. If it is going to be working increasingly in a face-to-face way, both in the outpatient assessment centres, but potentially also in the community diagnostic centres, then we need to rethink the service model because it started predominantly as a digital and telephone-based service. So it's just to note that recommendation in the paper. In terms of some of the smoking cessation data, I think it's reassuring that the community provision at the moment remains highest in our areas of greatest deprivation, which is exactly what you'd expect in line with the proportion of people smoking in those areas. There's a small increase in people seeking support to quit smoking, but I'd also like the board to recognise that increasingly we're now providing smoking cessation in different settings. So the piece of work that I referred to in my update with assessment of smoking status in acute trusts is where we're seeing a lot of additional funding coming in to integrated care systems to try to make sure that we're capturing every opportunity to nudge people into quitting. And hospitals are a very good place to do that. So I'm really pleased with the progress we've made there. And just to note that with some of our other community health improvement services, the supervised consumption service, which is supervised consumption of methadone, used to be on a daily basis. We've completely changed the pattern, partly because of COVID. They've moved to people collecting their supplies on a weekly, or in some cases, bi-weekly basis. And that continues. So it's a pattern of service change which we're comfortable with. We think it's better for the service user, and it certainly puts less strain on services having to come into a pharmacy every day. But it is being monitored very closely just to make sure that there aren't any unintended consequences. I'm going to move on and talk about the Children and Young People's Public Health Service. I think of importance for the board to note that the face-to-face visits for families with newborn babies have returned to normal. 98% of families receive contact within 30 days by a qualified health visitor. Obviously, that was very, very different during the first part of the pandemic, but the service is now experiencing quite significant additional demand. So they are having to prioritise visits based on the level of need, and that need is clearly increasing. The board, I was very grateful for the support for the additional investment into the service in the February meeting. That's enabling the service to think about how they can recruit to a couple of additional posts, particularly to meet the safeguarding pressures that are coming into the service. But the paper also notes that there are challenges around workforce recruitment and retention. So one of the recommendations in this paper is to support our bid to the integrated care system to make sure that we include workforce planning and the issue of health visitor recruitment and retention as part of our overall system workforce plans, because to date they've been a group that perhaps hasn't been thought about as much, but we think there'd be merit in looking at that as a system and making sure that we can use all tools that are appropriate to try to get the requisite skill set into the service. I was also going to highlight that the range of digital support tools to children and young people and their parents continues to expand. And although we've talked about Couth and Chat Health previously in the Joint Public Health Board, there's a new service which was launched in September, particularly targeted at families of children aged 0 to 5, called Parent Line. And the paper gives information about the use of that service to date. It seems very, very popular. They've had more than 5,000 contacts through that service to date. So as a continued theme of development of children and young people's services, that combination of face-to-face support and contact where it's really, really needed, particularly for families most in need, will continue. But also increasingly, we're trying to provide as much support as possible through digital means, which do seem to be very popular. That's all I was going to highlight with the board today. Just a reminder of the recommendations. So it's to support developing those options for the development of the Live Well Dorset service, particularly thinking about a joined-up approach with integrated care system partners. We'd like to note and agree the current approach to restarting the health checks programme following that discussion at the February board. And then the third recommendation is to support the plans within the Children and Young People Service to develop a more diverse and flexible workforce, and that will help meet those recognised capacity gaps. And the recommendation to the integrated care system is that we include consideration of recruitment and retention of health visitors within system workforce plans. Thank you very much, Chair.
Good, thank you once again, Sam. Okay, so comments, and then Councillor Wharf, please.
Thank you. Again, thank you for the content-rich report. There's a lot there. Two or three things completely unrelated. The first thing is there's quite a lot of information related to children's services here, and I'd just like to ask that we ensure that the Cabinet members for children's services from both authorities are invited and are aware that not only are they invited, because the Children's Services Cabinet member rang me this morning and I said, wrongly, I don't think you're needed. Actually, I should have said that, because I've been on holiday, forgive me, mea culpa, I hadn't read the report in detail, whereas I think there's stuff here that he would have been interested in and may wanted to have comment on, and the same for BCP, I don't know. So can we make sure we invite them? The second thing, this is really trivial, my copy, and I leant over and looked at Jane's, I think has got some track changes still on it. And can we, for the final version, can we take the track changes out, please? Sorry, this is completely all over the place. The third thing is, and this is a more philosophical point, until I changed portfolios, I was responsible for setting up the Power BI system within this council, which concentrated on metrics to try and demonstrate performance, and related back to my business experience of keeping it simple, having the metrics easily understandable, generally in the form of diagrams, and an indication of what is red, what is amber, what is green. Please don't take this as in any form of criticism, Sam. This is just too long. There's just too much there. I just, you know, my poor little brain can't handle it. You know, I'm not stupid, but this is just too much. I would, if at all possible, I would, over time, because these things should never be done too quickly, can we move towards a, you know, less is more, red, amber, green. I certainly would have the text at the front. I'd have it at the back. Maybe the text supports the diagram, or it's at the back, and less and an indication of, you know, what good looks like and what isn't good, and what we're doing about that which is not good, and what we're doing to promulgate that which is good. That's a very general, and I hate to make what sounds to be criticism without much more concrete proposals, but can we just start the process, please? Thank you.
Thank you, Councillor Wharf. I'll come back to something on that. Let me just not do what I did before and jump in straight away. Please, yes.
Thank you. So completely support the investment in children's services, and I'll note the councillor's comments about involving the Director of Children's Services. So I support the investment in principle, and I do support Sam's recommendation regarding the workforce planning for health visitors and school nurses, public health nurses in future. My concern is probably more in a little bit of detail in terms of the investment is into quite junior roles, and we know that they will be people that won't be known to that child or family. So there are some risks in the solution to get over the problem. So accept there is a problem, and I agree we need to have that initial investment. I just think perhaps we need to have a think about what that specifically is going to look like, or they will be the most junior nurses who would be having conversations in those strategy meetings or the conferences for child protection. So it was just a plea really that we can have a look at what that solution might best be, and I do think that we need to share that with our partners on the safeguarding partnership. Thank you.
That's it. Actually, Vanessa, for me, it sounded like you had something in mind there about, you put a challenge there very, very nicely. Just it sounded like you may have something in mind there about a mini recommendation that was in your head. And I'm sorry to put you on the spot. If there's something that you wanted to actually recommend that should be done or added to this, is there anything more you wanted to say?
I think there's probably a wider consideration. We've just had the national reviews that were published into the very tragic deaths of Arthur and Star, which clearly recommend that there is senior involvement in child protection, so at the very start, no, not the more junior. So my thinking is, have we got the right skill set at this sort of the most serious sort of intervention for children? Should we be twisting that around and having more experienced people in that area and doing something different in terms of that additional investment to skill mix to support the wider teams? Thank you.
No, thank you. No, thanks for your challenge. No, really, really timely. Thank you very much. Councillor Wolfe.
Sorry, when I did a Myers-Briggs test a few years ago, there's a sort of -15 to +15, where there's -15, I was told there were people with sandals who did research, and +15 are those people who are just completely deliverable orientated, and I was +15, so forgive me. Deliverables in terms of this, you're absolutely right. Can we make sure that this part of the report is sent to the directors of children's services of both authorities, the cabinet members of both authorities, and can we specifically ask them to comment on these figures? And I don't want to wait till the next meeting, because otherwise, we've lost it. All we need is some brief comments with a proviso that we're working towards simplifying it. But what I want to do is I want to involve them in the review of these figures now, rather than leaving it till later. And they may choose to say no comment, but if there's an issue that surprises them, and I think there will be, I'd like to know about it before the next meeting, and I'd rather it wasn't reported to the next meeting, but was issued to you, Mr. Clark, and that you issued it around the various people so that we had some prior notice. Because I think, I'm reminded of the importance of face-to-face, because it wouldn't have happened virtual, and I think we need to sort of almost reintroduce that physical virtual. Right, so can we have those actions, please? Thank you.
Thank you. Yeah.
Very much. Just picking up on the...
Introduce yourself.
Sorry, Councillor Jane Somper, lead member adult support to Councillor Wolfe. I just wanted to ask, just picking up on what Vanessa said there about the expertise or the experience of those contacts, because I was looking at the mandated contacts, which I thought looked quite impressive actually compared to the national average in England. But perhaps that's a little, that there's a nuance in there in what you were saying about, these visits are being made, which is clearly a good thing, but is the level of the visit at the level you would want to see it at, we would want to see it at, if you haven't necessarily got the experience of that. I hope that's clear. It doesn't, just a small point, but we don't have an England average for the first face-to-face. I'm sure there's a good reason for that.
Yeah, Vanessa, yeah, please, did you want to come back?
Thank you. I think we're probably talking about two different things. So looking at the performance indicators in Appendix 2, they are the routine intervention to children and families. So that's a routine intervention. The additional investment is specifically for safeguarding. So it's when there is a concern raised. So this is the day-to-day in the performance table. The additional investment, as I understand it, is to support those strategy meetings or the review conferences when there's a concern about a child or children.
So therefore, these are to be complemented then, in that sense that these are good figures compared to the national. No.
I would be concerned at the face-to-face visits performance.
Yes.
Yeah.
That one was the area of concern, because that's your initial. I know then you've got your 14-day one, but those could be crucial times.
Okay, thank you. Sam, did you want to come in on this?
Yeah, I think it'd be worthwhile just following up on the request to share this more widely with the Directors of Children's Services and also the Cabinet members, because there are lots of things going on in this conversation. It's really important that a universal service, like the health visiting part of the Children and Young People Service, do manage to see people in a timely fashion, and that's carried out by a qualified health visitor. The conversation we've been having about the strategy meetings is in relation to families where there are additional needs and concerns, and it's important that we get the balance right between the interface with early help services, which wrap around children's social care, and the universal service, which is provided by the Children and Young People's Nursing Service. And those balances can change at different times, depending on the pressure that children's social care is under in each council. So it's not straightforward, and what Vanessa's trying to raise is whether we've got the requisite level of skill mix into the additional posts to relieve that safeguarding pressure. But there's also, I would say, a public health discussion that we want with both children's services in both councils, which is about, have we got the balance right? So as more pressure comes in and as the demand starts to rise, sometimes the universal service gets drawn into areas of practice that we would say traditionally they don't do as much safeguarding work. So we just need to be clear what the need is. Have we got the appropriate skill mix able to respond to that, and that we're having that discussion as broadly as possible with both the children's portfolio holders and also the Directors of Children's Service.
Yeah, thank you. You know, just coming up from that particular example, just going forward, we know in this arena and the world in general, resourcing, I mean, it's a daily conversational item. Every form of life right now has got a resource problem of some kind. And for what we're talking about here, for the greater good of people's health and well-being, and for all those who work very, very hard, do we have something, sorry, I'm trying to form a question here that's not well formed in my mind even, is it in a sense left to a whole raft of sort of middle and upper managers to sort their resourcing out for the shorter term and the longer term in this whole area, whether it be in the local authorities linked to this, whether it be in the NHS, and whether it be in other partner organisations? I'm probably sounding a bit derogatory saying it that way. I'm imagining that is what's happening. Is there, alternatively, is there something which is taking a medium to longer term view, and also a view that brings in things like kind of the ageing population and the emergence of all sorts of new things that we anticipate we're going to be dealing with, and therefore the skills and the numbers of people we're going to be needing to meet that demand, where there's something, and if I say centralised, I say that with a kind of a heavy heart. That's you know, I'm not actually someone who wants to centralise things, but is there something where it's not just being left to middle and upper managers in a whole raft of areas to just get on and sort it out? That doesn't, because that wouldn't seem to be a thought through approach that's helpful. And it's a hell of a question I've just asked. Is there any thought on that right now?
I'll probably try and turn it round a little bit and look at the opportunities through the integrated care system. If we start with an integrated care strategy and we understand what the medium-term actions are that we need to take to relieve some of that short-term pressure, then I think we're in a space where we're being a bit more transparent about the planning in relation to what we think the need is. One of the challenges at the moment is when all services are under pressure and it's compounded by workforce gaps, then to try to manage that risk as much as possible, I see a system that tends to operate in the urgent space rather than the longer term. But we should be trying to get this right through working better together and collaborating through the integrated care strategy.
Come on that, I mean, that sounds fine. And I think we've seen a lot over the past year, and not just in this area, lots of areas where, you know, let's say managers done sterling work to expedite, to get people in, to take care of them as best they can and so on, to manage through COVID absence and other absences as well. And that's all short term, we'll say, just literally get through the week, get through the day, etc. But going forward, you mentioned there that it's within the ICS discussions to do this. is it really there? Is this being given appropriate priority in the discussions you've seen so far about how are we building, if I use the word workforce, the workforce of the future in Dorset in the broadest sense of healthcare? Are we actually doing that, or is that not happening?
Well, it's early days because the integrated care strategy won't be published until the autumn to late December, but it's incumbent on us as a system to then make sure that the rest of the organisations and the integrated care board's plans are starting to pick up on what we say in the integrated care strategy. So the children's priorities will form quite a big chunk of that first integrated care strategy. And that's why it's important we set the right signals in that so that we can have the right sort of focus as a system going forwards over the medium term, because it absolutely should be about planning for the longer term so that we can plan our way out of those pressures and not just keep responding to the urgent needs as they present. Does that make sense?
Yeah, thank you for that. I mean, just strikes me if people like, Councillor Wolf, Councillor Carl Jones, Councillor Somper, ourselves, Sam, you, me, my counterparts, I mean, if we don't do it, frankly, no one will do it. So it's incumbent upon us, as difficult as it is, to actually get our heads around this most difficult of problems and actually plot the way forward in it. So thank you. It started from your challenge, Vanessa. Thank you for that. A version of this is going on in many places. So thank you. We carry this one forward. We don't need to take a particular action. I'm happy that this is going to come in a subsequent meeting. Thank you. I had a few other points finally to make on this item, but is there anybody else who wanted to speak at all? On our recommendations, I'll just recap, which is to support the options behind the living well and the two examples we've had, and I'll get my visit in. I'm sure they'll rebook it for me. There was a point actually in the fourth recommendation about actually supporting broader ICS recruitment and so on. I won't repeat all the words around that. Sam, thank you. Continued approach to health checks, I think more of which is going to come, but I'm glad to see that that remains a priority there. And also the plans around the children and young people and the diverse and flexible workforce as well. Yeah, so I'd rather paraphrase those recommendations rather than read them out, but we've got them all there. We don't need to vote on this. I don't believe it was a voting item. Is that right?
Well, other than number 2, agree the current approach. So as there's an agreement, I think we're obliged to just
okay.
That
Okay, all those in favour of the recommendations? And I believe that's unanimous. Okay. Thank you very much. Now, just as a final thing, one last thing I had an asterisk against is the. I'm more familiar with the Beals, even though we didn't have the visit. I've actually been in there. I've seen it, and I've heard lots about it. This thing about rethinking the service model. And this is using the skills, using the people, using the know-how that people already have, but giving it a different setting and so on. I've known from other walks it makes such a difference. It can make such a difference, and not just to the customers and the people, but and so on, but to everybody working in it as well. And this broader movement here is something I'm a big fan of as well. I know it won't be applicable everywhere for certain. We can't do it in many places, but where we can, we should. Okay, excellent. I'll move on to the next item, if that's all right. Good. How's everyone doing? We've been going for an hour and nearly an hour and a half. We can take a quick break if everyone likes. Would everyone like a 10-minute break? Crack on? You like to crack on? Okay, fine. We're kind of weak in the east of the county, clearly, aren't we? There we are. All right, then. Let's go then to, I think we're on item 9 now, the health protection presentation. Just a verbal update, please, from Sam again.
Actually, I'm just going to invite Rachel Partridge to give a brief update for you. Thank you.
Good afternoon. So in the spirit of trying to draw attention to, on the agenda it was around health protection, but we agreed that it would make sense to really focus on the work that we've been doing to review and move into the space where we're treating COVID-19, learning to live with COVID-19, as that's been the lion's share of the activity around health protection in the last 2 and a bit years. So thought just quickly bring the board up to speed on what we've been doing since February. I looked at the date of the previous meeting and realised that time has moved on, history and context has moved on significantly since we last met in February. So I thought we'd quickly summarise for colleagues, and please do ask questions as we go along, although I might need prompting as I can't see. So the key area of work that we've been doing in the last 3 months has been very much trying to shift as the epidemiology and the pandemic has allowed us from that acute, absolutely intense response to COVID-19 as an emergency to trying to get systems in place where we're learning to live alongside it. So very much trying to shift it into more business as usual. Obviously, the peaks and troughs of various waves of Omicron in particular has been challenging, and we have continued to see, up until relatively recently, significant impact on services across our system in terms of workforce and challenges, just in terms of staff absences. However, we were really keen, as the intensity of the inquiries and responses tapered down, to actually really take time and opportunity as a system to gather and reflect and review what the good work we have been doing as a system, because it absolutely has been a huge challenge to the system, but something that has driven really excellent practice across a wide range of our interactions and has tended to break down lots of organisational boundaries to allow good collaborative work. And we were absolutely keen as a system, under the auspices of the Health Protection Board, to really capture some of those before time moves on and we get caught up in the next thing, or more importantly, revert back to previous experiences. So that's been a really big element of the work to date, and it's been significant time taken, but really, really important and valuable. We were also looking during this period of time, and we've been working hard to pull together responses protocols, identifying between us across systems what roles we have, what responsibilities, and how to effectively manage, particularly outbreaks or preventative work in our high-risk settings. And also keen to make sure that we don't all forget and move on, and we have got really clear ways of escalating and responding to any, heaven forbid, an increased level of pressure, probably due to a new variant. So, been lots of work. I've put too much detail in these slides, but I wanted to just have it for your so you're available to understand those key areas of work that we have been working on. So testing, since we last met, testing has been, the architecture has been dismantled, but as Sam mentioned earlier, that under the auspices of the Joint Public, the Health Protection Board, and the fact that 2 local authorities were really keen to make sure that we had a small contingency stock of testing available for those settings that were perceived as being particularly those working with vulnerable settings or vulnerable individuals, or through business continuity issues. So in terms of protecting the business service continuity, you'll be aware that some settings already have a national provision in terms of testing, for example, care settings. So lots of work on that. Contact tracing, interestingly, that was very shortly after our last meeting. Contact tracing was stopped very quickly. We had a cadre of very well-trained, experienced contact tracers, and we were concerned about making sure that they were gainfully employed, and we made a commitment to have their contracts extended until June 2022. We would not have known it at the time, but this proved to be absolutely invaluable in the fact that we had a resource of very skilled telephone operators and people experienced dealing with the general public, because they have now been redeployed for both councils to support the response to the Ukraine resettlement programme. So a good outcome, not at all planned, but shows how quickly the world has changed. Outbreak support is something that we continue to provide. Absolutely, the intensity has reduced in the last few weeks, so we're continuing to look at how to refine our capacity being used on our COVID response in terms of the response element. But we felt absolutely, and being steered by the Health Protection Board, that we needed to have something in place to be able to respond if key settings have concerns or outbreaks that they're dealing with, and very much supporting the model with the UKHSA as they're shifting and their capacity is shifting. And just to note, the consultant out-of-hours rota ended at the end of March. We continue to review whether things come in over the weekend that to articulate whether that is the right decision. Absolutely is the right decision. We're not getting contacted out of hours for anything that's not manageable within hours, and certainly not of an acute nature. And we're trying to shift back to our local response, reflecting what our local responsibilities are and allowing UKHSA to provide that urgent out-of-hours response should it be needed. Again, reviewing the surveillance and epidemiology is still a really important piece of work that our team do to provide for the system, and increasingly challenging as the various data streams are getting turned off, specifically around COVID. So the work is absolutely looking to see how we incorporate COVID as just another metric or element within wider health protection data. Lucy's still lurking in the back, but wanted to take an opportunity to say that this has been a really excellent area of our work. And through the pandemic, unfortunately, we have got very used to and are much more adept at using different networks and skills and communication channels to engage with our communities. And we really want to build on that and continue to identify what works well and what we should build on. So that's a piece of live work. And Lucy's sliding in her chair. Behavioural insights, again, this is an area that we've worked on through the pandemic, and we're looking to see what we can build on from there and look for periodic sense checking about perceptions and needs and responding to community feedback and insights. I'm not going to touch too much on this because it's clearly under the remit of the Vaccination Delivery Board, but vaccination programme for COVID, alongside all the other vaccination programmes, continues to be a huge area of work. And I think for us, as Public Health Dorset, we are committed to keep involved with that, and particularly looking at where we can help support where there's any inequalities in terms of differences in uptake as future waves of vaccination gets released. Just to note that we have the Contain Outbreak Management Fund in place and available to us until the end of March 2023, and we have clear plans through the 2 local authorities to manage those. And the final thing really is to point to the work that I felt it was important to bring here, or we felt it was really important to bring here, that we have taken that opportunity to reflect and review and not to be carried along with the relentless tide of the next things to pick up on. So we're absolutely committed to learning from our experience and the good elements of our system working through COVID, but use that as a way to move forward. So we are re-establishing the health protection network, which predated COVID, and it looked at the broad range of health protection issues for Dorset as a system. And COVID will be incorporated into that, but it won't be the sole focus. And the work that we're currently doing, which we'd like to bring back to talk to you in more detail in the informal session at the end of June, is around our sector-led improvement tool that we're using, which is a regional tool which allows us to do some in-depth review of the infrastructure and systems and processes we have in place around health protection, mindful of the changing organisations, so UKHSA being established in place of PHE, understanding where NHSEI fit, understand where the ICS fits in health protection, and the national review of the regulations. So there's quite a lot of movement and churn in the health protection space, and we really wanted to have a good understanding of what we have in place. Are there any gaps, and understand our roles and responsibilities for the future, specifically from a Public Health Dorset Local Authority public health perspective. So that's the key focus now. Any questions?
Thank you very much, Rachel. Great canter through. And just you whizzed through that. There's a hell of a lot there, and we know that. And we've been, we've seen a lot of that, albeit from maybe a distance, not quite as you've seen it, but a hell of a lot there. Any points, please, anyone?
Thanks very much for that. The comms bit that you talked about, I'm always nervous because we've got 3 separate comms units, and I'm not convinced they always, in fact you could say 4, I'm not convinced they always work together as effectively as they might, and it's certainly not deliberate, it just happens that way. And I think there are some really useful comms messages that I would like to be, pan-Dorset. There are some that are Dorset Council, some that are BCP. I'd just like a commitment that we'll think about this so that it isn't just a joint public health board comms, because I think some of it could be really useful through our joint channels, etc. I don't know, but just can we just think about it a bit more, please?
Thank you. And the reason I put it in is because I think it has worked particularly well because of the urgency and the intensity of the experience around COVID. So I know that comms colleagues were working very closely on from a warning and informing perspective. So it's about building on that learning of what worked well, because I think that challenge is appropriate and fair in normal times. So I think picking up on the learning and the excellent collaborative approach that we got from this emergency situation, we can capture. And also reaching parts that we didn't traditionally used to. So building on our networks and our tools and our engagement, we had to work very differently, and testament to communication colleagues for really working hard to establish that.
At the risk of
Can I just say that was captured, was your, as long as we've captured the action, that's okay, is it? You've got it. Okay, thank you. Anyone else? Sam, please.
Thanks, Chair. It was just a slight rider to the final point. From a Director of Public Health perspective, this is all about going back to the position that I was in before the pandemic, where my responsibility is to provide assurance that the system is working, but not necessarily doing it all. And it links to the comms point, because in future outbreaks, if we're not in an emergency situation, then it's usually going to be UK Health Security Agency who will lead on the comms. Where they need support is if it's affecting settings like schools, care homes. They obviously need to work with partner councils to be able to get the message out effectively, but they are the lead agency in communicating outbreaks from now on. So just looking to Rachel to make sure I've got that right. That's the most important bit to make sure that we're joined up on, and we'll make sure that we have those conversations with both councils.
Okay. I think there's a couple of things I want to say on that. Is there anybody else at all who wants to come in? Anything? Okay, I'll just go. Just on the comms point, I agree in spirit with with Councillor Wolf. I think it's maybe hard to I wouldn't say criticise. I think a hell of a lot of good work was done. Extraordinary hours and at amazing speed over the past year. Nothing takes away from that whatsoever. But you're right, Rachel, in the comments, sort of looking forward and learning lessons going forward. Because I think certainly during the period of the peak of vaccinations, let's call it, I think certainly there were times where I was sort of left hand, right hand or whatever, and certainly speaking as a cabinet member in a council, there were a few times, a fair number of times, where it's literally sort of like scuttling between various different things, trying to sort of give a definitive response to people on something. So I was being at times the joiner-upper. Now, please, such is life as a councillor. I'm forever being a joiner-upper of things, so nothing's new. But there's probably something there around, even with a difficult picture with many details flying around, something there about something approaching a singularity of message would have been great. Now, I know I'm saying this to yourselves in this meeting. I should be saying this in other meetings to other people as well. Absolutely. There is something around that. And also just there's something around the broader narrative around it as well, because I do understand that out of urgency, the comms tended to be of a type which was here and now, today, tomorrow, looking ahead the next few days and so on. I think what is valuable as well as that is something which is further looking, and even, dare I say, as she's looking back a little bit as well. We don't often want to look back when we're giving in the heat of the moment communications, but literally, okay, everybody, literally in perspective, this is the month so far, this is the quarter so far, this is what's been done, and there were some good instances of that, and looking forward, this is the path that we're on going forward. And certainly there wasn't much of that, maybe for good reason, but that's something else which can give people a more rounded understanding. Because, you know, from maybe speaking personally, is too much of news I read in all sorts of spheres is sound bites in the here and now, rather than news that helps build a deeper understanding of the subject for people. And maybe I'm speaking to myself, I prefer the latter, in a sense, that helps me really understand the piece. I think there's a market for that still in this area. And it's got a broader implication, I think, what we're talking about here, because as we go forward, let me link it to Councillor Wolf's comment about the report that we got for this meeting, because I should have said so at the time, Peter, I agree with you, is that the value of a more summarised piece, actually, I think, Sam, is actually in being able to use it as a communications piece as well. I personally don't mind reading big, long board reports. It comes with the job. And I quite like dipping into a lot of detail. It's obviously then important that we have the appropriate level discussion in this board, and we don't go into all that detail. But I think the value of a higher level report is actually to send it either before or immediately after the meeting and make that part of the formal communique to our residents. And I'll be damned if those in the ICS and the ICB, etc., wouldn't find it interesting as well. That kind of summary is something that would be read by a lot of people, I imagine. Police Crime Commissioner, fire chiefs, various others as well. I imagine it would be widely read. So that's something there that maybe we can take forward. That was on the comms side. It is a very important subject, in fact. Is anything else from anybody on the comms bit? Okay. Yeah.
This is directed at Rachel, although you'll have to go to your left to get the information. 2 years ago, I conducted an EAP of members, it's about 18 months ago, where we reviewed COVID and lessons learned. And a very, very detailed report was produced. Forgive me, I'm going to set you some homework. Can you have a read of it? Primarily, because what I don't want you to do is I don't want you to miss some of the really good work that we put in on that. That, you know, I'm always a great believer in copying and pasting other people's work if I can, rather than inventing it myself. So it was an EAP that took evidence from a number of people, including Paul Eggleston, etc. So, you know, we're well aware of it. Yeah. And we had about 8 meetings. We had a lot of various people reporting to us. And if you can do me a favour and send a copy to Mohan, because because I think you might find it interesting. But what I don't want is I don't want you to come up with lessons learned that misses some of the ones that we've already been. You know, I'm sure you wouldn't, but, you know, I'm just trying to save your time. Thank you.
And there are a couple of final comments I wanted to make on this item. One is, just bear with me as I hop around a couple of things. One is about the COVID-19, the vaccination, the ongoing thing. We know a little something about this, which is what does sort of peacetime look in this, and from the SRO, we had a presentation some months ago on this. Just keen to see whenever's appropriate what's intended here. I think if I remember right, I was gobsmacked when the COVID vaccination is only one of something like 32 vaccinations in existence. I didn't quite realise it was that many. So it sort of will take its place in that portfolio of things, which is an enormous amount of work, I know, but good to see that at some point. And again, the comms around that will be important, in fact, just to keep everybody calm and just to say, hey, everybody, this is what we've got now. This is it, to keep everybody safe and healthy. Glad to see the conf date, the Outbreak Management Fund date, as I think that date's moved about 3 or 4 times, hasn't it? But I'm glad, however that's happened, that the date means that the monies remain available. Very, very good. So congrats whoever's arranged that. And the last thing was about I tuned into the discussion at the Health Protection Board about what lessons learned to carry forward. And I was thinking, because I learned so much from listening in to everybody who was there, who'd been immersed in all of it. And particularly the discussion was focused on processes, capturing, what were sort of the technology implications and so on, what data was needed and so on. And if I may, and I'll say it now, is I thought one thing that was kind of not vocalised in the meeting, but it seemed to be sort of threaded throughout, was just the ingenuity and the flexibility of the people there. And we don't need to, my rather, sort of dull background in advising companies on managing change, it's something that's never quite, we don't find the words for this kind of thing, but it's the ability literally to draw people together who've got a variety of skills and literally give them the flexibility to invent their structure, invent their way of working, and literally deal with the problem as most effectively route one as they can. And how do you write that down on a bit of paper? Well, with difficulty, but actually what it means is keeping a cohort of good people. Frankly, the number one is not losing good people, which I know is enough of a challenge. And the other thing is sometimes is not prescribing processes or the use of systems or, definitive sets of data and so on, but allowing these people to draw on their natural abilities and their instincts and so on, because I think that's what's got us through a lot of this vaccination programme over the past year. And that's an absolute gem of an asset that, in a sense, we don't need to do anything to, other than keeping people, is to actually not get in its way, to let that natural thing take its course. And I think this should be a central ingredient of ICS going forward as well. ICS, I think for me, last comment from me on this, ICS will be less about kind of big diagrams on paper, I have to say, and much more about cohorts of people doing wonderful things in multi-partnerships. Okay. Thank you. I'd say that bit. Anything else on this item, please? No? Good. Thank you very much, Rachel. Okay. So, I think the item was just a note. I don't think there's any voting or any decision required on there. Okay, so we'll go then to item number 10, please. A lot of work into the business plan. So page 65 to 103 in our report. So Sam, please.
Thanks very much, Chair. I'm going to make a few brief comments, and then I'd like to introduce Sarah Longden, our Head of Service Planning, who's done a lot of the work behind the scenes to get the team into the right place to produce the plan. We're very grateful for Sarah's support on this. So, as you know, it was difficult to focus on business as usual public health, and it felt as if we were coming to the joint board multiple times to say, we're nearly ready, but we're not quite ready. And then we got dragged back into Omicron wave 1 and then Omicron wave 2. We've finally managed to clear the decks a bit and to put in the work with the team, particularly that internal work, to have a look at what we think is most important that will be in front of us, and getting people to think differently and to stop thinking COVID mode, but to think system, because one of the biggest external drivers will be the integrated care system. So hopefully what Sarah will talk you through is the process that we've gone through to prioritise our top 10 programmes in particular, based on an understanding of what we understand is coming forward from our communities, and the recovery COVID-19 report that Peter just mentioned is a good source of some of that insight as well, of what's important to communities at the moment. So we know that physical activity dropped off, we know that mental health demand is rising across all ages, and we know that the inequalities piece is going to be hugely important, not least because the cost of living pressures that people are facing at the moment. Just a very quick note on risks and challenges. We had previously highlighted the loss of public health staff during COVID. So I think we hit a turnover of close to 30% at one point. Unsurprising, given the pressure that the team was under. But I'm really pleased that that's now stabilised and we've recruited 2 vacant posts. There's lots of training and onboarding going on. But I think our team is better for having a diversity of people coming through it and not having potentially people stuck in roles for many years. And we've also done a lot of work through our redesign of the team structure and the move to new contracts to enable progression through the team as well, which we think is really important. So Sarah will take you through the plan, but I would just say we've also flagged that the integrated care system will probably be a new and emerging pressure on the team because of the level of ambition. The fact that it's probably my fault, I've stepped forward as Director of Public Health and said we think this is really important. We think it's really important to support it as a public health team and to make sure that we're helping to lead the system in the development of that new strategy. But it does place pressure on the rest of the team, so apologies for that. We'll do our best to make sure that we're managing that capacity as transparently as possible. So over to Sarah. Thank you very much.
Thank you. So yes, I'm Sarah Longdon and I'm the Head of Service Planning, Public Health Dorset. And a main area of my responsibility is to develop the annual business plan for public health and to manage any changes in our team and our service as a result of the development of the plan and emerging changing priorities. So last year and the year before, I was very much focused on programme management of the Health Protection Board. That was our #1 priority. And as that's wound down and we're now able to look at the building up our business plan and going back to basics really and our business as usual, which has been quite great relief, I think, to a number of people. So my responsibilities involve and include the plans and the scope, setting out the priorities and making sure our work is aligned to that, and particularly our resources. Talked about capacity and resources. We need to make sure that we're focused on our priorities and reviewing our delivery models and the functions in public health to make sure that they're appropriate as the work evolves. So the business plan is published. You've seen it in the pack. I won't go through it page by page. Leave you to have a read through. Hopefully it's clear and concise and makes sense to you. So what we need to just draw out from the document is the programmes that we deliver ourselves and our priorities. We've looked into what our priorities are. We can't do everything, so we've had to sort of understand what's most important of what we deliver ourselves, and we've heard a bit about that today, but also the work that we're involved in, which is led by others in the system. Equally important, but a different role and a different purpose for us. We do need to make sure that we're clear on any overlaps or duplication to make sure that we are managing our time wisely. Can't be everywhere all the time, so if our objectives and our purpose is clear to ourselves and our partners, then that we can make sense of that and be in the right place. The plan also needs to dovetail with the emerging integrated care partnership strategy and local authority transformations and other changes in the system. All of our work is connected with the system, and we wanted to make sure that we're clear about that context and what's driving us internally and externally in the business plan. So there's a few pages that relate to that. So the work of our senior management team, as Sam's mentioned, we had to go right back to basics and really think about our core purpose and our main objectives in public health, having understood the environment and the changes around us and what's happened and what we've learned through COVID. So we've re-clarified, if you like, our purpose and objectives, and they're set out in the document as well. A lot of work had to be paused because of COVID, and we're restarting that work, but we needed to understand and be clear that we're restarting the right work in the right way and not just doing everything as we used to, but that it's the right work that we're focusing on, taking into account all the learning, as we've mentioned as well. So we've set out our purpose, main objectives in the pack here, and pages 84 to 88 explain our 4 objectives that underpin all of our work going forward. And I think that they are health improvement, health protection, healthcare public health, and healthy places. And you've already heard quite a lot about some of those 4 areas in some of the discussions today. And our work programme, therefore, is organised under those 4 headings so that we can be very clear that the work we do delivers and achieves those objectives. So we had to, as I say, go back to looking at our priorities and making sure that we're clear on those. And on page 93 of the pack, you'll see our top 10 programme areas, which are the most important for us and for the system in meeting our aims and objectives. It's not everything that we do, but we have to be able to understand the priorities and put most of our time and effort and our resources into those. So I think it's worth just having a quick look at our top 10, if we call it that, to see what we will focus on and the board will be looking at over the year ahead. So under the health improvement objective, we've got the Healthy Child Programme, mental health, drugs and alcohol, healthy lifestyle support, and sexual health. So you've heard a little bit about some of those areas of work already. Health protection, we've just heard Rachel explain about where we are with health protection. So the programme Prevention and Control of Infectious Diseases is in our top 10 as well. Under healthy places, the built environment and local plans. And then under the healthcare public health objective, the programmes around health inequalities, joint strategic needs assessment, and population health management. So our business plan explains a little bit about what they are, and we are now in the process of scoping and defining those areas of work so that we can make sure that the activities and the work that we do is targeted in the right way, and we'll be able to report back to this board progress in meeting those in the fullness of time. So as I say, this isn't everything that we do, but it is the most important. It will help us manage our capacity, our resources, and our time on there. The second appendix in the pack gives out a little bit more detail about the actual activities that we're working on now, and we'll build that up into our more detailed work programme and schedule over the next period of time. And when we come back to the next board meeting, we'll have more details on that. So I'll stop there and take any questions.
Good, all right. Thank you. Thank you very much, Sarah. Okay. So we've got a big report then to go through. Councillor Wolf.
Well, I'm well aware of Sarah's ability to do an excellent job, so because she was ex-Dorset Council before she was poached. That's okay, Sam. We're not bitter. We're not bitter. Much. This presentation, Public Health Dorset, I think is excellent. I know there may be other small issues with it. I think it's excellent. I think it very, very clearly defines and describes what you're there for and what you do. I think it's absolutely excellent. I'm afraid I'm back to a deliverable again. I would like 2 things down with this. I'd like a members' seminar for our councillors, and may I be rude enough to suggest you do it for your lot as well, where you present this to our councillors, because I think it's, you'll have to summarise it a bit, but it's there. The second thing, which I think is probably more important, is to go through comms and to try to get this wider promulgated to a bigger audience. So go through parish and town councils and get it presented to them, because I think most of them do not have any idea of the breadth and the importance and the scope of the work that you do, and I think it would help to it would help to solve a number of the arguments I have with parish councils about why aren't you doing this, what are you doing that, etc., etc. So, yeah. So please, can we have it as a member seminar? I think it's excellent, Sam. And please, can we have it as a town and parish council generic to the public, but through town and parish councils? And I would suggest you go through our comms to arrange that. I just think it's excellent. It's I read it. It's a really good presentation because you read it and you almost don't need the words. In terms of somebody speaking, I can work out what it means. So, well done. Thank you.
Thank you, Councillor Wolf. Yeah, I've got a few comments, but anything, Sam, did you want to say something?
I mean, just first of all, I think, is Lucy still with us? Yeah, so Lucy has been instrumental in translating a lot of output from sessions with the team into something that's really readable. So thank you for the feedback, because it's really important for us that this document is an engagement tool. So I completely agree with Councillor Wolf's question, which is we are intending to be able to use it as a document to engage with what we do. So we'll take up both of those recommendations. In terms of parish councils, I do regularly go to the town and parish council briefing, so I'll make sure we have a session on the next agenda via Matt Prosser, and we'll make sure the document's sent out as well, working with comms. So thank you for the feedback.
Okay. Sorry, can I whilst the vast majority of town and parish councils are associated with the Town and Parish Councillors Association, Dorset, they don't always engage. And it is, my experience is it's better to try and engage A, directly, and B, with groups of them. Now, I know that's a slight contradiction, but it is possible to engage directly with groups of them. And you just have to, and go through the members, because that's what we're here for. Because we go to parish councils because we're very sad like that. Jane has got 14, and I've got 8. My life is, I'd be lost without them. Thank you.
Thank you. Any other comments at all? I've just got a couple of bits myself. To start with the one that's just been picked up on the comms side, yeah, absolutely agree. To jump to the end point, yes, I'm happy to support this in this meeting. I don't, unless anybody wants to, I don't want to get into like the content of everything, this priority, that priority, etc. And I don't think that's what you're asking for anyway. So it's something we'll kind of approve this now, but take it forward into our next informal, etc., to flesh it out rather more. I'm very happy we do it that way. I mean, implicit within that is probably a bit of a challenge for me, which is sort of the route this took to get to this meeting in a way. But it's okay because we know how we're moving forward, which is fine. Just for things like this, actually, again, harking back to our discussions about ICS, ICB, Health Wellbeing Board, for instance, and even CSP and so on. I mean, if I ask, have they had any sight on this on the way to this board? It doesn't matter. I don't want to put anybody on the spot with that question. Even if the answer's no, it's something like, this is the way we should be going forward with this kind of thing, which is whoever's been involved in it. Something like this deserves, I know it's a lot of work, but a bit of an airing and a bit of a sort of a town hall sort of input into it. And in the market square, as it were, figuratively speaking, so that we come here and it's almost kind of, we know this has got broad support around it and it's landing in the right places. But it's okay, a lot of work has gone into this, and that's what we'll do now as the next step with this. Since we're on the page 93, Sarah, you guided us to here to, quite rightly, to these top ones, then it's got me thinking, for instance, well, okay, there's 10 here, but I know, for instance, smoking that you talked about, Sam, as part of the Live Well programme, and then, for instance, young, teenage mums and things like that, that's one thing within that. Oh, so are those 2 in addition to the 10 and so on? Help us with that, because if I'm thinking about that, then surely some others would have that kind of question, as frivolous as it might be. So how many priorities have we got? I'll just carry on. I'll just finish with my few points, Sam. It's a business plan for the current year. Now, the current year, we're already 2 months into the current year. Call me old-fashioned. The business plan is probably for at least 3 years. And then we've got like a short-term plan or a priority list and a budget for the current year. This, for me, would be even more powerful, maybe in perspective, given everything else that's changing around us. It's right that this is just a 1-year horizon, maybe. The next iteration of this, it would be wonderful if this looked ahead. And let's be bold, for over a good 3-year horizon, because that's when you've got the room to do strategic manoeuvring of the whole thing. And then the last thing, of course, is, I mean, for instance, if I say, yes, Patricia Miller's seen this and smiled on it, etc., you know, that's where we need to be aiming towards, this sort of thing, a broader group. Just one comment on the comms. I absolutely agree in spirit with Councillor Wharf, is the one thing just to think about as we go into things like council briefings or briefings to any broader group. This is a presentation about Public Health Dorset, which is one party, albeit a very important party, in the whole piece. Let's not present this and then have people wondering about, for instance, would our colleagues in NHS be making a different presentation? And would the CSP be making a different presentation and leaving the audience to join all that morass up together? Let's, you know, we don't take the job on here joining that up ourselves, but let's make it a bit easier for the audience to understand some form of joined up picture. Okay? Once again, it's a similar theme as before. Yeah, this is the prize. Thank you. Thank you.
Actually, I was just going to come back on a couple of your comments because I think they are excellent suggestions. In terms of 1-year business plan, I would hope that the priorities may change going forwards as we get out of this year and we start to establish our business a bit more systematically. But the structure and the aims and the objectives of the service won't change dramatically. And on the point about the direction of engagement and sign-off, it's a really good one. I would hope, because we're maintaining a flexible approach to this plan, that as we take it through town and parish councils, we share it with integrated care system partners, we're able to respond to that and we can reflect that in the plan as it changes. So I think the most important point for the board is that we use the development of the programmes as they're scoped to populate the forward plan. So I hope that people see it very much as a live document, but the architecture won't change too much.
Yeah, just to say it with the microphone, great, that's the spirit in which we're approving and discussing this. Wonderful, that's good. Thank you. Any other comments? Sarah, please, yeah.
Yes, thank you, Chair. Just to come back on one of your earlier comments, that these priority programmes, they are by nature quite broad and wide-ranging programmes. So the example about smoking cessation comes under the healthy lifestyle support. So without the detail behind it, it's and the familiarity of the programmes, it's you know, it's not always immediately obvious what the breadth of activity is. So, but that will come through as we go through into future reporting in more detail as we all understand more about it.
Anything else? I think for such a big and sort of weighty report, a very important report. I know we've not had much discussion, but hopefully that's a sort of contented quiet we've got here, at least for the while. Anything else at all? Oh, good. Okay. Well, I think we're asked to, let me just double check. Okay, we're asked to consider the report, which I think we have done.
Might I just say there's also 2 parts. One is to agree with public health Dorset business plan as it stands, as you say, yes, the first recommendation is in fact to agree the business plan as it stands with the riders that it will then be taken out and see what other organisations make of it. But hopefully the programmes that we're obliged to commit to are all included, and that's the headings in which they are. So there was an agreement. There was a need for an agreement.
So thank you, Mr. Northover. Yes, I should have gone back to my recommendations at the top. So recommendation 1 is agree the Public Health Dorset Business Plan and priority work programmes for 22-23, the current year. Second recommendation, consider developing the forward plan for the board based on the work programmes included in Appendix B. So particularly on the first one, which is to agree. All those in favour? That's unanimous, thank you. And on the second one, which I think we'll also do this, consider developing the forward plan for the board based on the work programmes included Appendix B. We've just considered it. That is absolutely fine. Okay, good. Okay, well thank you for that item. I think all the good work in that is good discussion in that is actually ahead of us now. But this is a great baseline. I totally agree with Councillor Wolf's comments, okay, and deserves to be kept as a living document and kept in sight of people. Very good. Okay, so that's item 10 covered. We're going through at a good old pace, I have to say. Thanks, everybody. So urgent items. So for me to consider any items of business which the chairman has had prior notification of and which considers them to be urgent pursuant to section 100B, subsection 4B of the Local Government Act 1972, and the reason for the urgency to be recorded in the minutes. So, Secretary, have we received any urgent items? That's what we do. Thank you. There's no urgent items then. And item 12 then is for the dates of the future meetings. So we've got one in reverse order. We've got them 16th February 23, for which we just need to settle on a venue, but we've got some time to do that. 1st December 22. As long as we fit it in around Christmas parties and so on, we can sort that one out. But of some urgency is to get the July 22 date and venue arranged.
Chairman, if I might, the date for the July meeting is to be determined. From discussion prior in this meeting, I think the director mentioned that perhaps some of the things that they would wish to bring to a July meeting, that date might be a little too early for. There is a date that I have identified, being the 6th of September, on which there are no Dorset Council meetings and there are no BCP meetings. So I'm just putting that there as a suggestion, and whether or not that sort of timescale fits in with the type of things the director is able to do.
Okay, so what I've got so far is okay. I think I'll come to Sam next, if I may, please, because I think Sam will shed light on what what the state of readiness is. So Sam, please.
Thanks, Chair. It was just to note that by the time we've met the date for clearance of the reports, it's probably less than 4 weeks away to meet the July meeting. So I don't think there'd be any merit in having a board. I'd prefer to come back in September, and we'll work with David and colleagues to find a date, because by then I think we'll have better sight of some of the integrated care system developments over the summer, and we'll be further ahead in the scoping of the programme. So there'll be, I think, much better content for the joint board with proper decisions rather than just coming forward with monitoring reports, if that makes sense.
Yeah, Councillor Wolf, yes.
We've got a to be confirmed cabinet on the 6th of September. Pardon? I said there's my answer. The fact is to be confirmed, that is the reason. Yeah. But Kate's put it in some of the diaries, but obviously not yours. Yes, absolutely.
Okay. Can I just, if it's the 6th, that sounds fine. Just on the principle of, I agree with you, Sam, literally with the lead time for the papers and so on. It's almost, there's not much time between this and the next one. But then with the summer holiday, the inevitably is then maybe the opposite problem. Now we're running to June, July, August, September, 4 months until we meet. And I'm just worried that, I'm mindful, August is a difficult month, for instance, to meet. But going 4 months at this time of rather a lot of change going on is too far away. Is that an inevitability, do we think, with everyone's diaries and with summer and so on? Or I'm just a bit nervous about 4 months, to be honest.
So I've got the option of an informal board. We're meeting on the 30th of June. I think we could put another informal board on over the summer, just to keep portfolio holders cited.
Excuse me. Sounds okay. Are there any key decisions that need to be formally voted on that can't wait until September? No. Yeah, Councillor Wolf.
The 30th of September is the LGA conference. I can dial in, absolutely. But I know both myself, Matt and Spencer will be there. Well, if it depends how long it is. If it's an hour over breakfast, that's fine.
Just for consideration, board, if it's to be an informal meeting, would there be some worth in that just being held virtually?
Okay.
Okay.
All right, these details we can work out. I was just bringing up the point of the principle, which is there anything important in the calendar, given what's happening with ICB, with progression of ICP? I don't want us to miss anything important, because we let a few months go by. I'm reassured if there's an informal board, the next one is in the diary, another one shortly afterwards. That sounds really good. I don't mind if it's in person or virtually. I'd rather it was in person, I have to say. And we'll make sure we don't miss anything then. That's really important. And especially the roll forward of the forward plan, as we've just been talking about. These are the things important to me. Okay. But that's fine then. Okay, in which case then we will lift out any July 22 meeting and leave it with yourself, Mr. Northover, to work with us about a September date. Okay? Good, good. That covers that item. Okay, I think. Okay, and I think that is the last item on our agenda, unless there's anything not urgent but an AOB matter. Otherwise, I'll close the meeting. Thank you so much, everybody. Thanks for your attendance. Thanks for your engagement. To say the least, subjects of the highest importance, not just for ourselves, but for everyone in Dorset. But thank you for your attention and for your hard work at this time. Okay, a very good day to you all.